want to look at what's causing the infertility crisis. Why are girls in this country reaching puberty 6 years early, earlier than historically? Why do boys in this country have half the testosterone teenagers of a 68-year-old man? I grew up with NIH. I visited when I was a boy. I loved science, and those were my favorite afternoons, visiting the labs at NIH.
Do you hate medical research?
No, I think we need to lead the world in medical research in this country.
In fact, isn't it true, Mr. Secretary, that you would like to see more money spent on medical research?
Obviously, I'm the secretary of this department. No secretary wants to see his budget cut. The research that has been neglected for the past 20 years on chronic disease and what's caused us to go from 3% of Americans of children having chronic disease when I was a little boy and my uncle was president to 60% today. I would want to look at the thousands, over 10,000 chemicals that are now in our food. Most of them have never been tested. I'd want to look at what's causing the infertility crisis. Why are girls in this country reaching puberty 6 years early, earlier than historically? Why do boys in this country have half the testosterone teenagers of a 68-year-old man? Half the sperm count of a 60-year-old man. I would want to do research on why our bees are disappearing, why 90% hive collapse happened, which is a food issue. I would want to look at the microbiomes in the soil and how that's contributing to erosion and how chemicals that we're using in agriculture are sickening farmers in many cases, potentially, and are destroying the microbiome and creating a situation where soil is running off and where most agronomists believe that we only have 60 harvests left. And I would want to look at why we're having an explosion in Alzheimer's in this country, not just curing it, but what is causing it. And I think NIH has done a very good job at making cancer more survivable. For example, colorectal cancer, where there's been extraordinary science done at NIH. Why isn't NIH asking the question, why do we have colorectal cancer in children? This is something that's new to humanity. It was never known before. And now it's an epidemic in our children, and we need to have a balance where we're looking at cures for diseases, but we're also focusing on how to keep Americans healthy so that we can beat these ruinous healthcare costs and that we can have a healthy, productive society.
Do you hate NIH?
I love NIH. I grew up with NIH. I visited when I was a boy. I loved science, and those were my favorite afternoons, visiting the labs at NIH.
Do you hate medical research?
No, I think we need to lead the world in medical research in this country.
In fact, isn't it true, Mr. Secretary, that you would like to see more money spent on medical research?
Obviously, I'm the secretary of this department. No secretary wants to see his budget cut.
Well, one way of doing that, it seems to me, would be to stop some of the stealing. And let me tell you what I mean by that. Let's suppose you give NIH gives a university $100 million to research, for medical research, to research a cure. And that university takes $30 million of it, doesn't spend it on the research. They use it to subsidize the rest of their university. Does that show a commitment to medical research?
No, and I mentioned before the example of Stanford, which was taking 78% in indirect costs, and we don't know what they were spending.
That's theft, isn't it?
It's not a good
in
way to
Louisiana,
spend
we call
federal
that stealing.
Taxpayer dollars.
We call that stealing. Is there any doubt in your mind that a lot of universities are taking this NIH money, which is supposed to be spent on medical research, and using it to fund other parts of their university. Is there any doubt in your mind, Bobby?
Oh, and Senator, the other people who are writing grants, like the Gates Foundation, the Rockefeller Foundation, they paid 10% to 15% in indirect costs. We were paying 50, 60, 70%.
So, in fact, what you're doing is adding money to medical research.
We will be able to fund many, many, many more studies by eliminating that $9 billion, at least part of that $9 billion cost.
Okay. I want to ask you about LIHEAP. Are you familiar with this GAO report they did on LIHEAP? LIHEAP?
I am not, Senator.
They found, they audited 7 states. They found 11,000 dead people getting LIHEAP grants. You familiar with that?
No, but that is pretty typical of many of the other programs that we're working with.
They found prisoners getting grants, didn't they? Were they using the grants to heat their jail cell? They found 1,000 federal employees getting the grants with federal salaries that greatly exceeded the income limits. They found some of those folks living in $1 million homes.